Welcome to the final section of Dermatology in General Practice, Adverse Reactions to Food. In the next 15 minutes, you will learn what causes adverse food reactions in dogs and cats, some of the classic breeds and ages of pets that we see with adverse food reactions, where we should be focusing our attention to diagnose adverse food reactions, what unique allergic disease symptoms cats show, whether asthma, vomiting, or diarrhea can be linked to a food allergen, the best way to diagnose an adverse food reaction, and the essentials to an elimination diet trial. A food allergy or sensitivity is an abnormal response by the immune system to a dietary ingredient. Unlike people, food allergies in dogs and cats tend to be acquired over time. Owners will often be surprised to learn their dog or cat could be allergic to something that they ate for years with no issues. Is the term food allergy accurate? We hear it and use it all the time. And we're often using it incorrectly to describe any adverse reaction following food ingestion. Strictly speaking, the term food allergy should be reserved for immunologic-based hypersensitivities. In veterinary medicine, unlike human medicine, we will often not know definitively if reaction to food is a true IgE hypersensitivity-related allergy versus an intolerance. So what is the correct terminology? The American College of Veterinary Dermatology classifies any abnormal reaction after ingestion of food or additive as an adverse food reaction. The underlying cause for these reactions could be an immune reaction due to a protein source that is now seen as a threat, or it could be a physiologic intolerance. Peanut or shellfish allergy in people is an example of an immune reaction. Lactose intolerance is an adverse, non-immunologic response by the gastrointestinal tract to lactose. Non-immunologic reactions are dose-dependent and can happen on first exposure to the chemical, additive, or metabolite. Grapes, raisins, onions, chocolate are all additional examples of foods that can cause intolerance in veterinary medicine. Food hypersensitivities are immunologic adverse reactions. Food allergies can be IgE-mediated type 1 hypersensitivity, and there may be non-IgE-mediated, therefore type 3 and or 4 hypersensitivity. Food intolerance are non-immunologic adverse reactions. There are food-dependent factors like toxins, poisoning, or contaminants, or host-dependent factors like enzyme deficiencies, drug reactions, and idiosyncrasies. Food allergies are the third most common allergic skin disease in dogs, following flea allergic dermatitis and atopic dermatitis, and account for almost 1/3 of all allergic conditions. Food allergies are the second most common allergic skin disease in cats, following flea allergy dermatitis, accounting for 10 to 23% of allergic conditions in cats. These are the top breeds associated with food allergies in dogs and cats. Many of these will be familiar repeat offenders that come into your practice with allergy signs and symptoms. This pup has been scratching since the owners brought home their fluffy bundle at 10 weeks. What's on your list of diseases based on the age of this puppy? In general, an underlying adverse reaction to food should be considered in any pet that develops pruritus and associated clinical signs prior to 6 months and after 6 years of age with no previous history of skin disease. Can a food reaction happen at any age? Yes, but typically in young animals. 1/3 to 1/2 of dogs with adverse food reactions develop clinical signs prior to 1 year of age. Cats are typically young when they present as well. In cats with adverse food reactions, the typical age at presentation is less than 2 years of age. What is the most common owner complaint? It's itchiness. Non-seasonal pruritus, so pets that are itchy year-round despite the season. Food history is very important in diagnosis. The majority of dogs who develop an adverse food reaction have been on a diet containing the offending allergen for significant time. In rare cases, there may be a direct correlation of onset of pruritus with a dietary change or indiscretion, but this is most often an exception to the rule. Can a patient be allergic to more than one antigen in a diet? Absolutely. The typical antigens of concern that the immune system responds to are protein sources. Carbohydrate sources can, in theory, contribute to adverse food reactions. They do contain small amounts of protein, or they could result in non-immune mediated reactions. Soy, barley, and legume reactions have been reported in dogs, but rarely. The most common antigens are meat protein sources. Food allergy is often associated with other pruritic skin conditions, including atopic dermatitis, flea allergy, superficial pyoderma, and yeast infections. When food allergy is noted along with atopic dermatitis, the patient may present with year-round pruritus with seasonal peaks when offending allergen load is particularly high. Food allergic patients may respond temporarily to antimicrobial therapy as secondary infections are treated, but pruritus will return and possibly lesions at the termination of therapy. Greater than 60% of patients with food allergies have a minimal to absent response to anti-inflammatory doses of glucocorticoids. They are itchy, itchy, itchy. The most common clinical sign of food allergy is pruritus. Other clinical signs include erythema, scaling, crusting, alopecia, hyperpigmentation, and papular eruptions. Urticaria and angioedema are less common, but can occur. Malodor may be a client's primary concern and can occur when a secondary bacterial or yeast dermatitis is present. So where to look in dogs? The classic areas are ears, rears, and feet. Ears are most consistently involved in 80% of cases. 61% of cases will involve the feet, and 53% will involve the inguinal and perineal region. Could it be only ears? Almost a quarter of the time. In 24% of dogs, the ear may be the only affected region of the body, and otitis can be bilateral or unilateral. Dogs pay a lot of attention to the rear end area. Is this an area we should be paying attention to? Check those rears. The frequency of perianal pruritus in dogs with atopic dermatitis and or adverse food reaction was significantly higher than that in dogs with other diagnoses, with 52% of dogs with atopic dermatitis and 51% of dogs with adverse food reactions. About 1/3 of cases with adverse food reactions will have armpit, foreleg, and periorbital symptoms. Adverse food reactions can trigger other skin conditions. So while you may diagnose something separate, the underlying root cause could still be an adverse reaction to food. Where to pay attention in cats? Adverse food reaction in cats can present similarly to dogs, but studies have previously tried to document regions on the cat most commonly affected by adverse food reactions, and it appears that the head and neck are more commonly affected than ears, feet, and rears. There are 3 important clinical syndromes that we need to pay attention to with cat allergy and adverse food reaction: eosinophilic granuloma complex, self-induced symmetrical alopecia, and miliary dermatitis. What about the gastrointestinal tract? Almost 1/3 of patients will have concurrent gastrointestinal signs, ranging from vomiting to anal gland impaction and scooting. When you are diagnosing an adverse food reaction, pay attention to the GI signs as well. Other signs of interest in investigation include general feeling of malaise, seizures, behavioral changes, hypoactivity, attention deficit. All of these could be signs of an underlying adverse reaction to food. Are respiratory signs possible with adverse reactions to food? Respiratory signs that are associated with adverse food reaction include asthma, rhinitis, and sinusitis. asthma is primarily a feline concern. Let's get down to business and test for which allergen is causing these reactions. What test do you want to reach for? A blood test, saliva test, skin test, endoscopy, hair analysis? In people, they have the means to determine what you're allergic to with specific tests. Given the significant percentage of dogs and cats that may be exhibiting adverse food reactions, having a test that alerts us to single or multiple antigens is absolutely expected. However, studies in dogs and cats show that these tests are not always accurate or dependable. This includes blood tests, intradermal skin testing, and more invasive testing like gastroscopy. So not all of these tests have been shown to be dependable and accurate in every case. The gold standard of diagnosis for an adverse reaction to food remains a diet trial. This is the best diagnostic procedure, an elimination diet with subsequent provocation trials. So let's talk about running a successful diet trial. Dietary restriction confirmation of food allergy really can only be determined by a novel protein restriction diet trial. So the diet is changed to one with a combination of ingredients to which the animal has no previous exposure. When multiple previous diets have been tried or the diet history is unknown, choosing a veterinary hydrolyzed diet may be the best choice. The diet is then restricted to exclude all other treats, table scraps, pilling vehicles, flavored medications and toothpaste, flavored toys, anything else that could be introducing an antigen to this patient. Protein sources are more often to blame than grains for adverse food, so selecting a novel protein with no history of exposure is paramount. The most common ingredients that cause food allergy are really just the most common ingredients found in pet food. Homemade diet choices are an option as well. The gold standard of performing a restricted diet trial is to use a home-prepared diet under the strict supervision of a veterinarian or veterinary nutritionist. Novel protein sources currently available for home cooking can include kangaroo, camel, ostrich, emu, bison, elk, venison, rabbit, goat, duck, or fish. In some patients, lamb or pork may be an option. And there may be other patients where their history includes many uncommon protein sources, and you'll have to find an alternative. A novel carbohydrate is chosen alongside the novel protein source. There are no food additives in homemade diets, so they must be restricted to a short period of time. You do need to do the homework before the home cooking. There are pros and cons to consider when choosing between commercial novel protein diets or hydrolyzed diets versus strict home cooking. Prior consultation with nutritionists regarding specific breed and feline requirements is advised. Generally, home cooking in cats is discouraged given the commercially available options and the risks that are associated with feeding an unbalanced diet. Veterinary supervision is critical at all times for each individual. Feeding a balanced diet from the start is preferred whenever possible, so a commercial option is preferable. There is no guaranteed time during which one can feed an unbalanced diet. This is a conundrum. The gold standard for a dietary elimination diet would be home cooking, but we don't know how long a pet can eat that unbalanced home-cooked diet and still be safe. So each individual patient needs to be looked at to decide what is appropriate for them and their household. Cats can be more finicky than dogs and can become bored with a restricted diet after it's fed for a prolonged period of time. Strict observation and weight monitoring is very important. Cats should also be kept indoors during a diet trial to prevent hunting, and this can obviously pose a difficulty for some owners. Diet trials should be 8 to 12 weeks. Given the prolonged duration, it is often more convenient and potentially safer for an owner to choose a commercial option. Commercial over-the-counter, retail, limited ingredient diets are not recommended due to the potential for mislabeling and unintentional contamination with potentially allergenic ingredients. Veterinary diets are preferable over retail diets because you can know their cleaning procedures and their strict ingredient contamination control. A large variety of limited ingredient foods exist commercially based on different novel and hydrolyzed protein sources. Commercial diets will, of course, have multiple ingredients and additives compared to the simplicity of a homemade diet. So again, each individual patient needs to be looked at to decide what is right for them. What are your other keys to success? Set reasonable time expectations as to when some improvement may be noted. Most owners will agree to trying a strict diet trial for a month, and this can set them on the right track to extending the trial if needed now that they have seen some improvement in their pet. Client education is really the recipe for success and needs to include all members of the household. Family members need to understand the principles and all agree to take part in the elimination dietary trial rules. Supportive treatment of pruritus is going to be important in both managing the comfort of the pet and the stress for the owner. Owners need to know there's treatment available during the trial. Success stories are great news, and food therapy is the best medicine. Diagnosis of adverse food reaction is a good news story. Most owners are satisfied with a positive response to the elimination trial, and they do not want to embark on the final provocative challenge part of the elimination diet trial. This part, though, is the only way to truly determine the offending allergen. With this in mind, new treats or supplements should always be introduced one at a time. So if there is a reaction, you know what the reaction was too. There are many options for low-risk treats. Various individuals have varying thresholds as to how much of an allergen is needed to trigger a response and how immediate that response will be. Now the disease can be controlled by dietary management. How highly convenient for both the owner and the pet that they can keep their pet feeling great by restricting what they're eating. In addition to resolve pruritus, often owners will note other improvements in gastrointestinal function, improved appetite, reduced scaling, glossier coat, more energy. Well, thank you for spending your coffee breaks learning about dermatology and general practice. We're glad that you've joined us.